Okay, so this video is going to give you some tips and tricks for taking care of your spine outside of the office. As you're just starting care here, you're probably coming 2 or 3 or 4 times a week for your adjustments to begin correcting your spine and improving your nervous system. But that's only a few days a week. You're probably working 2 or 3 or 4 other days. You're driving in your car, you're sleeping in your bed. So I want to give you strategies to help you take care of your spine on your own, at home, at work, in bed, and all those things too, so that you can take care of the most important structure and system of your entire body. So when we talk about the spine, oftentimes we think of just the bones and you know the relationship and the skeleton and keeping us up. But the main thing to understand too about this is that your spine is what houses and protects your nervous system, which is by far the most important system of your body. Remember, the brain sends signals down the spinal cord, out the nerves, to go to all your organs, all your tissues, all of your cells. So literally how healthy you are is directly proportionate to how healthy your nervous system is. So when we look at the spine, and I have my model here, a couple key reminders is that your spine from front to back has to be straight up and down, okay? And from the side, you have to have 3 perfect curves in it. So there needs to be a forward curve in the neck, backwards curve in the mid-back, and also a forward curve in the lower back as well. When your spine is in this position, your body is able to heal and function at 100% or near perfectly. And therefore, your health in your life and everything along with it will be near perfectly too. So a couple keys with this is that when we think about this is what's going on the inside, so what do we see on the outside? It's your posture. So one of the things is that our patients will tell us, and maybe you already have as well, is that you will now start becoming a lot more aware of your posture, which means that when you've maybe been working at a computer like this for a significant period of time or driving in your car, you'll begin to notice in the areas and the times that you're slouching, which is great. We want you to start recognizing that. Because when we really look at the neck and the importance of that as far as posture goes, when you think about people in a nursing home, what's the position that people are always in? They're always slumped over in a chair like this, taking dozens and dozens of medications every single day, not feeling well, not doing well, not able to move. And we don't want you to end up there at all. Part of the reason why this happens is if we particularly look at the neck here, remember, this is normal. This person's looking out the door this way. If you can see here, there are red rubber cords in here. What those are representing are your blood vessels. So these are called vertebral arteries. They are one of the main blood supplies to your brain. So if you think about there being pinching or choking or twisting going on in your neck, how do you think that's going to affect your blood supply? It's going to shut it down. And if your brain is not getting enough blood, that's going to create problems with your health, your thinking, how well you're able to remember things because it's being shut down. All right? So we're going to be working on your posture and your arc of life. Most of you probably work at a desk or a computer, and so we need to make sure that you're getting optimal positioning there. The last thing when it comes to posture too, I know you're watching me on a video, but what I want everybody to do right now is I want you to stick your head out in front of your shoulders as far as you possibly can, okay? And try to take a deep breath. It's very restricted, isn't it? Now if you bring your ears back over your shoulders like this where it should be, now you take a deep breath. And you can get a lot deeper. So literally, when your head shifts forward and slumps forward, it begins to choke off the oxygen supply to your body and make it very, very difficult to function normally. So when we get into things like your work now, your workplace, what I want to stress is your computer positioning, all right? So one of the main things you can do is you can take your computer monitor and take a big old yellow phone book or two if you can, put it underneath your monitor and prop it up. So that way when you are sitting at your desk in your computer, you should be hopefully not being like this. You should have a slight extension or looking slightly up at your computer screen as much as possible. Because you see when we do that, that's going to support a healthy curvature in the neck rather than straightening out and causing compression and damage to your spine and your spinal cord. So elevating your monitor up as high as you possibly can. So that's something very easy you can do at work so you're not causing 8 hours of stress and damage or more on your spine, but we're actually creating 8 hours of normal function and normal positioning. Also, a lot of our patients will take this wobble cushion, which you'll be getting in your home care kit, to them with work, because by sitting on it all day long, it creates a dynamic system, okay, that makes sure that your lower back will not lock up or degenerate and break down as well. So that's another tip and trick that you can do and utilize as much as possible. Other things are some obvious ones, taking a couple minute break every hour to stretch and arch your back and your neck and really stretch out those muscles, because what happens is when people are working like this all the time, their shoulders become rounded, and then their posture begins to get more and more crumpled up like this, and that's when you see old people that are sick and diseased, right? So working on stretching those muscles and opening that area up there will help your overall posture and function, okay? Other things too, so when we think about driving in a car, that's something you probably spend anywhere from 20 minutes to an hour or more a day in your car. And so there's other things you can be doing to be helping with that. So if you have a longer commute, and I would say really if you take more than 10 or 15 minutes one way to do that, what you're going to do is you're going to take this little roll that you get with your home care kit. You can buy another one if you need another one just specifically for your car, or you can take a towel and roll it up as well. And you're going to put it in your car seat in the arch of your lower back right here, okay? Because by doing that, that'll prevent your spine from sitting and rocking forward like this. It'll force your lower back to have good posture, and therefore force your upper body to have good posture as well, okay? So that's a great tip that you can do. Also, utilizing your headrest, okay? Whenever I go to a stoplight, I'll actually push my head back into my headrest for about 10 or 15 seconds, not straining, but pushing a little bit. What that'll do is strengthen the muscles in the back of your neck, kind of like when you wear the head weight on the vibration platform. And again, help to work on pulling your head back to where it should be and not letting it slump forward. So those are two easy things that you can do in your car that'll really help. So listen, I know some of these things seem obvious or maybe even downright tedious, but you have to understand and remember that your spine and your nervous system, you only get one of them, all right? And it's the most important thing that you have when it comes to your health and your wellness. And so you take care of it every single day. The reason why people get dentures or have lots of cavities or rotten teeth that fall out is because they don't maintain and take care of your teeth. But the reason why people can have nice healthy teeth and gums until the day that they die is taking care of it. It's the exact same thing with your spine. So these are strategies along with your chiropractic care that will allow you to take, not only get your spine corrected, but then we'll be able to maintain it and keep you healthy and well for the rest of your life. Okay, so I'm going to take a few minutes here to explain the second part of your home care, the kit, okay, the pieces of equipment that you got, and also some of the stretches and exercises that you need to be doing to get your spines corrected. So everybody's going to be getting two things to go along with their kit. There's going to be an exercise guide here that will have pictures and a written description of every single exercise that you need to be doing. And you'll also be getting a prescription sheet here which will have specifically marked out exercises as far as number of reps on there and how many times a day to do it, how long to do each exercise according to your spine and the challenges that we need to overcome. So when you look at your sheet, you're only responsible to be doing the ones that are marked out. So don't do the extra ones there, but really you need to be doing this as closely as you can follow this as closely as possible, because the more you do at home on your own, the better that's going to help myself or Dr. Emily to get your spine corrected. So you'll look at what exercise is marked out on this sheet. You'll refer to this guide here, and if you even are more visual, we'll be providing a link and resources to videos to actually be watching other descriptions on how to do all of the exercises. A few of the key ones I'm going to go over right now. So every single one of you will be getting a head weight like this. Okay, you've worn it when you've had your first couple of adjustments when you've been standing on the vibration platform. How this works is that the weights are going to go in the front. Okay, you're going to wear it just like a hat. You're going to slip it on like this. Make sure you tighten it. So let me get mine tightened here. Good. So as you're wearing this, I know you've worn this already, but what it's going to do is it's going to kind of force your head to be pulled down this way. And so that's going to force your muscles of the back of your neck and upper back and shoulders to pull back this way here so you stand upright. This is going to reverse and prevent that forward shifting posture like this here, okay? And so you're going to be doing this at home. Now, the way I do it, the easiest way, is that you can wear this. I know it looks silly right now, it's all right. You can brush your teeth while you're wearing it. You can talk on the phone. But the key thing is you need to be standing and keeping your head in a neutral position. Don't be on the computer like this doing it. Don't be, washing dishes bent over like that. You need to make sure that you're looking in military posture, upright like this with shoulders back. The best thing to do is walking while you're doing it too. So that's why if you're talking on the phone, or you can kind of pace back and forth up and down your hallway from anywhere from 3 to 5 minutes a day. You don't want to go much past that because the muscles in your neck will start to fatigue, especially in the first couple of months. before we move on to longer time, more weight. Nightstand and night table, I guarantee you will not use it as much as you should. This will definitely hurt your progress if you're not using these 5 to 7 nights a week. We want you to get the best results. That's why we take the time to film these videos for your home care. If you have any questions about how to use anything specifically, I'm going to put the link on here for where the videos to go look at them, or you can always ask myself, Dr. Emily, or any of the staff, and we'll be able to make sure you know exactly what to do. We recommend that you start off with about 20 of these twice per day, working your way all the way up to 60. If you have any arthritis or degeneration in your spine, we may recommend that you do more, because this is going to make sure that does not progress or advance at all, and it actually can show, it can even reverse it a little bit if you do it frequently enough. Otherwise, your discs will rot, degenerate, and break down if you don't get this moving the way that it should. So the final piece that we're going to go over is your sleep rolls or your sleep aids, along with your pelvic wedges. And this is probably the most important one, because at nighttime, the nervous system is the only system that speeds up. All right, every other system of your body, your heart, your lungs, your digestion, everything else actually slows down at nighttime. But at nighttime, the nervous system will speed up. So we need to make sure that we put it in the most optimal positioning, again, while you're laying down. Most everybody also gets triangular wedges here, and this is designed to help correct hip imbalances. So there's one of 3 positions that you might have received, and it'll be marked on your sheet. It's either going to be right high, left low, or the opposite, or they might be both high.